Good evening, friends. This is Melvin from SRM Medical College Hospital, Chennai. I work here as a professor of the Department of Clinical Pharmacology, and I'm joined by my friend Dr. Sreekanth Gattu from Switzerland.
Yeah. Hey, Melvin. So just to tell about myself for those who don't know me, I'm Sreekanth Gattu. I'm a pharmaceutical physician working in the space of clinical development, clinical research for the past 15 to 16 years now, more or less. And I'm currently based in Germany and Switzerland border. I working for a multinational pharmaceutical company here. And so I'm here together with Melvin just to give you a little bit more details about the course CPD, Certificate of Pharmaceutical Development. And Melvin, would you like to give some opening remarks about what the course is about, and then we go into some of the questions.
Okay. So to start with, the certificate course in pharmaceutical development is a course that is meant especially for students of MD pharmacology. So this would really be something that is supplementing their existing knowledge that they gain through the MD course during their 3-year period in pharmacology in the different universities in India. So to start with, this is a hybrid course. So you have an opportunity to get it done in the midst of your regular schedules that you have. You will be in your colleges. You will have to participate in the core classes that will primarily be happening only in the evenings and probably on the weekends. So it is something that you can do amidst your course, that is your degree in your respective universities. So, Sreekanth, just for everyone's understanding, who exactly is the ideal candidate who should be joining this course?
Yeah. So primarily the course is targeted for anyone who's a student currently doing MD pharmacology or DM clinical pharmacology. And if they are recent pass outs, say for example, they are doing their bond period residency, they're also can join this course. So there are some requests where they just join the industry. Can they still participate in the course? Sometimes there are some requests which are so I'm associate professor or professor in a medical college. I would like to join just to understand. So we are open for those candidates as well, but they need to account for the time and effort that is required for this course. But the course is primarily targeted for those students who are in MD, DM, and recent pass outs who have serious intention to get into the pharmaceutical industry, because the goal of this course is to make you ready to your entry into the pharmaceutical industry. That's the main purpose of this course.
So why exactly should I join this course? Because I know I have so many friends who have got into pharma industry without joining any special courses. So how does this really benefit me?
Yeah. So we all know the kind of academic training that we receive in MD pharmacology, right? So we are very well trained in basics of pharmacology, applied aspects of pharmacology, etc. So my observation is that while there are a lot of aspects which are trained to us, there is still a training gap for most of the MD and DM students in terms of what is required in the first 2-3 years of your industry life, right? So yes, without this course, or for that matter just with MD pharmacology, you can still get a job into the industry, right? But the difference is, like, if you're getting into T20 cricket match, now do you just want to play as usual, like how you usually practice once in a while and then get into the match, versus you do some good amount of net practice for which is targeted for the T20 match for about a week or 2 weeks and then get into the match. So it really preps you, it gives you an advantage, it helps you to be that differentiator once you get it. It can help you in grabbing that job. It can help you once you get into the job in first 1 year. Someone who's just MD pharmacology versus someone who's gone through this course where we tell you, what are the different practical aspects of medical affairs, different practical aspects of pharmacovigilance or clinical research. So you know that stuff already. Not only you know that stuff, you get to do some hands-on and then you get in there. So yes, without this course also you can get a job, but then you can be Virat Kohli when you get into the T20 with this course, I would say.
So how exactly is this course going to be structured?
So the course basically has it's a not only hybrid from a delivery perspective, but also from a content perspective. So there are two big parts to this course. So the first one is giving you the knowledge. So this will happen over approximately 50 webinars. So these webinars, they are virtual. This will be delivered mostly in the evenings or weekends, right? And then once we deliver the knowledge to you, then we will make you apply the knowledge that you have learned. So this will happen as part of case studies, and the case studies will happen both virtually, but also in the face-to-face module, right? So when you start applying these things, so when I say this, case study, so this is where in the virtual setting, we will pull you into teams virtually, and then you will be given some sort of a case studies or project discussions, and then you apply whatever you have learned, and then you deliver that. And then when it happens in face-to-face module, so the face-to-face module is basically divided into two parts. So we have first part of the face-to-face module, which is a 2-day event, which happens probably in the end of August. And here we will focus on soft skills. So the communication skills, presentation skills, and all that part, right? So this will happen at the beginning of the course already. And then the second part of the on-site module or the face-to-face module will happen once all the webinars are being delivered. Now you have the knowledge, and then you have also probably done a couple of virtual case studies. Now we put you in a room together for 3 to 4 days. And then we also bring industry faculty, experienced industry faculty. We give you case studies. We create situations. We simulate the real world, the problems that are actually happening in the pharmaceutical industry. We make you do that. And then you present how you handled it. And then there will be the industry faculty who will assess how you have done. And then, all that stuff will happen. So the face-to-face modules is the one the closest that you can get to the real world. Once you enter the industry, what will happen in your daily life. So is that and sorry to interrupt, one last thing. So in the 3 to 4 days, the end module that will happen, so there will be a dedicated day for the career development discussions. So this day will be utilized to kind of perform some mock interviews, prepare you for your first job, how to plan yourself in the first 1 year, 1 to 2 years when you get into the industry. So the face-to-face module will include not only the hands-on aspects, but also the career development discussions, etc. Also, the beauty of this one is you get to hear from your peers, right? So your student friends. So you have similar ideas, similar thoughts. And then we have alumni from this course who have done this course from previous years. So these people will also be invited. So you can ask them, how this course has influenced their career in the initial days. And then we will also invite experienced people who have spent like 5 years, 10 years, 15 years in the industry. And then you can grab. So you get to hear about the career aspects from different cohorts of people who are at different stages of their career.
So I understand that there are 3 different segments within this course that we are targeting. I think one is pharmacovigilance, then medical affairs, and clinical development. Is that right?
That's correct.
Okay. So do people really get an opportunity? Like, can we say that this course would give them something kind of a guarantee in any of these sectors in the pharma industry? A job.
To be blunt, so you're asking, I do this course, is there a job guarantee? That's the question, right? So to keep it blunt, the answer is no, right? So I don't know if any other courses are promising this. As someone who's recruiting, students or doctors from the industry side, I can tell you no course will guarantee a job, right? So the same way, this course will not guarantee you a job. This course will not, let's say, increase the chances of you passing the exam and all that stuff. So that there is no guarantee of that one. But what I can tell you is this course is going to prepare you for the real world experiences in the industry, right? So this course is targeted towards making you a better person in your professional space.
So, Sreekanth, did you feel the need for such a kind of course when you joined the industry in your initial years after you completed your MD?
Yeah, so I finished my MD in 2010, and at that time, I really felt like there were a lot of questions in my mind. What is this part of industry? What happens there? Is it the right place to start here and then move to a different place? So at that time, I really felt a need to have such training course, or forget about training course, even if someone who can tell me all these things, right? And then fast forward 2023, I speak to students, I still feel the same thing, right? So not much has changed. Students still have questions. They're not getting clear answers or straightforward answers. So people are still curious, and I think this course is an attempt to fit that unmet training need and to help those students who have questions. We will give you answers. We will not give you jobs.
Yeah. So from what I understand from the way you're speaking, I understand that there's a lot of scope for the students to interact with experienced pharmaceutical professionals working from India and even probably some from outside India. And so through that process of interactions, I think the students will definitely learn the practical aspects of what it means to be a pharmaceutical physician, be
Yep.
it in clinical development or pharmacovigilance or medical affairs. So just the last one question that probably some would be having is, if I am someone who's just joined MD pharmacology very recently, the first year, is it okay if I join this course now, or should I wait till my second year, or do you say it's for someone who's finished or about to finish the course, maybe third year? So when should I join?
So there is no wrong time to do the right thing, right? So a lot of times I get this question, sir, I just completed my MD pharma. Can you give me career guidance how to get into the industry? And my reaction is, it's too late. So, in ideal world, I would suggest to my students, if there is something like my student, my recommendation would be to start, exploring in this direction right from first year, right? So having said that, I understand that there might be some concerns or questions about, oh, I don't know anything about pharmacology, I don't know anything about clinical research. So you don't have to worry about it. So as like I said, the course is structured in a way that there are at least 50 sessions where we are giving you knowledge. So we are teaching you what happens. So we are giving you theory. So grab this. Irrespective of your first year, second year, third year, it doesn't matter. As long as you are paying attention and digesting this information, you're all the same. And then what will happen when you are going on virtual case studies or hands-on sessions during the face-to-face? So the knowledge that you need to apply in these hands-on sessions and case studies is actually coming from the same webinars that we have already delivered, right? So if you are a first year student and there is something in a second year PG curriculum and you have not learned that yet, that doesn't matter for this course, right? So you are a medic, you know how the pharmacology aspect at a high level works, then all good. Then you're good to come into the course. You gather knowledge through webinars, you apply them in the face-to-face modules and virtual case studies. Don't worry.
Thank you, Sreekanth, for giving your valuable insights on the questions that are posed by different candidates who are looking at doing this course. Thank you.
Yeah, I thought I'd ask this.
Continue. You can continue. I think it's
okay. Okay. So then, Melvin, let me return the favor, and I have been also getting some questions more from the admission procedure and the process, etc. So I received some questions like, so I don't have a PG certificate. I'm first year, and the application process is asking me for a certificate to upload, or some things like, I started the registration process, but I'm not able to get through. What do I do? Whom do I contact?
Okay, fine. So in terms of the certificate for PG course, if you are still doing your first year MD pharmacology or second year, all that you have to do is just attach your allotment order that you have been allotted MD pharmacology in XYZ Medical College in this university. That should suffice. Even for the mark sheet, you can use the same allotment order. It will be acceptable. The most important certificate would be your MBBS final degree certificate. That will be the one that is very critical for this course in terms of the certificate verification. Yeah. So, and in case you're stuck up at any point of time, you could, there are two numbers that are mentioned in the brochure. So please feel free to contact those two numbers and we will handhold and help you in completing the registration process.
Thanks, Melvin. And other question that I was asked is that, so the exam looks like either a weekday or a working day, and it's exam is a big thing. So what if I'm interested, but I won't be able to write the exam because it is, I don't know. I don't know how long is the exam going to be, 3 hours, 6 hours. So what would you say for that?
Yeah, so the exam as of now it's scheduled on the June 30th. That is this week, this Friday. So we will be able to this is going to be a very simple examination of MCQ for 30 MCQs, and you will hardly take maybe 30 to 45 minutes to attend this MCQ. So irrespective of what situation you are in, I think you can try to spare some 30 to 45 minutes for this doing this examination, entrance examination. It will be done online. You just have to join the link that we send you. And once you join the link, we'll give you the second link to fill the question paper online itself. And in a very fast, within a short time, you'll be able to complete this exam. So it's just no writing part. There's no long answer writing type kind of questions. It's all MCQ based. So I'm sure you will be able to complete it very fast and carry on with your other tasks that you are involved in.
Yeah. No, thanks, Melvin. I think that was helpful. We know that we want to communicate all this information to the prospective students. We have also already released a couple of videos about the exam content and all that information. So I highly recommend students to follow the Instagram and Facebook page where we are releasing all this information, the Path to Pharma P2P, and keep following this page for any more updates. So Melvin, you want to say any last words?
Yeah, nothing else. Thank you. Thank you.
Yeah.